Now let's talk about chronic inflammation. Chronic inflammation happens when the body cannot get rid of this kind of invader itself, and that leads to macrophages signal for chronic inflammation. I told you that chronic inflammation are seen when there is infiltration of lymphocytes, and lymphocytes or plasma cells. So you can see lymphocytes are those cells that are oval shaped, and the nucleus is big, and you can see that they are this like oval shaped, very dark kind of appearance, purple, dark purple appearance. Plasma cells are those cells you can see in this slide. For example, here we have the nucleus, we have the cytoplasm, and there is a light portion of cytoplasm, and that shows the presence of plasma cells. Okay, now you know that in chronic inflammation, and when we are talking about lymphocyte, we have two types of lymphocyte. One of them is T cell, another one is B cell. Now let's talk about T cell. You know that T cells, they mature in our thymus, and we have two types. We have helper T cell, or CD4 positive, and CD8 cytotoxic T cells. Now what you have to remind is that CD4 or helper T cell, they can recognize major histocompatibility type 2 only, and CD8 positive or cytotoxic T cells, they can recognize major histocompatibility type 1. Now they have these TCR receptors on them, and via these TCR receptors they recognize the major histocompatibilities. They also have the second signaling pathway, and that happens via CD28 and via the connection with B7 receptor on any kind of cell that they recognize the presence of major histocompatibility type 1 or type 2. Now after that, these T cell, they cause the activation and apoptosis. We talked about it previously in the previous lesson, but it happens via the extrinsic pathway via TNFR1 Fas or ligands, and that leads to activation as caspases, and caspases activates the apoptosis. Alright, now the second type of lymphocytes are B cells, and these B cells, they can get activated by two ways. One of them is when the IgM is activated, and another way is we recognize a pathogen, and they take this pathogen inside themselves, and they produce these major histocompatibility complexes on their membrane. And then TH cell, they recognize these major histocompatibility complexes, and via the second signaling pathway with CD40L or CD40, they signal and send some cytokinase, and B cell then transform into plasma cell, and then plasma cell produces, for example, IgE or immunoglobulins.